Hi guys, Mrs. Spurlock here, and this week we're going to be talking about the patient-physician relationship and the roles of paternalism and autonomy within those relationships. Now, when we're discussing bioethics, the relationship between a patient and a physician is one that we discuss quite often because a lot of bioethics centers around what is appropriate and inappropriate to do to humans. So the physician has duties towards a patient, and a patient has rights from the physician because the physician is in a position of sort of like power, and his or her better understanding of the body is either going to give or limit access to a healthy life from the patient. So a physician's duty is to provide beneficence towards the patient, and beneficence is a word that means to do good and to actively avoid harm. It doesn't mean to just do good and not do harm. It is within the physician's responsibilities to avoid causing harm to the patient. The patient rights include skilled beneficence, meaning it is unethical for a physician to intentionally mistreat a patient, as well as autonomy. Autonomy refers to a person's rational capacity for self-governance and self-determination. It means that people have a right to decide what is or is not appropriate for their lifestyle in regards to medicine or many other facets of life, but since we're talking about medicine. Now, when we have these conflicts that require bioethics to come in and say, here's what the right thing is, it often involves a conflict of physician beneficence and patient autonomy. So before we dive into how those conflicts come about, we're going to talk about how we can exercise autonomy. Anytime a person is making a choice or a decision that is entirely their own and not influenced or manipulated by another person, we would say that they're expressing their autonomy. One of the fundamental principles across all of ethics, and especially all of bioethics, is called the autonomy principle. Autonomous persons should be allowed to exercise the capacity for self-determination. And from the autonomy principle, we derive the principle of informed consent. Informed consent says that if you are going in for a procedure or taking a medicine or participating in a clinical trial, you have a right to know what's happening to your body, what kind of medicines you're taking, what the symptoms are. In the event that it is a medical procedure, you have a right to know what your quality of life, what kind of quality of life you should expect following the procedure, and things like that nature. Now, this concept of paternalism becomes a problem when we're talking about making decisions for ourselves. Paternalism is the overriding of a person's actions or decision-making for his own good. And conflicts between beneficence and autonomy are going to often fall under the umbrella of paternalism. When we look back at the history of medicine, we actually see a pretty strong tradition of paternalism. However, as human rights have improved, paternalism has become less and less common of a practice. We do still accept what's called weak paternalism. And in weak paternalism, a person's autonomy has either been hindered or taken away from them completely. And so a physician would have to make a decision in which they may or may not override the person's autonomy, say, for example, in the event of a car accident that leaves someone unconscious. They don't have the ability to refuse or accept treatment, and the physician is in a position where they don't have the background or information about what the patient would want, and it's an emergency that is life or death. So the physician will often make the choice to forego figuring out whether or not the patient may or may not want the treatment because it's the difference between life and death. That's called weak paternalism. It's considered morally acceptable. What's not morally acceptable is called strong paternalism, the overriding of a person's actions or choices even though they are substantially autonomous. So some examples of beneficence and autonomy colliding include refusal of treatment. a patient has a right to refuse treatment. And this is going to take the patient's autonomy and cause it to directly conflict with the physician's beneficence. It brings about some questions that we have to ask ourselves. The first is it ever morally permissible for a physician to treat a patient against his or her will? And if so, what justifies these actions, and under what conditions is it acceptable? Ethics have gradually shifted from putting more weight on physician beneficence to putting more weight on patient autonomy. It takes the moral responsibility away from the physician a little bit and gives it to the patient. As patients in 2020, we're expected to be able to determine things about our medical treatment given the information that physicians provide us with. So unless there is an advance directive, a patient completely loses autonomy in extreme situations such as a coma. The following excerpt that I'm going to read for you is an example of where patient autonomy has conflicted with physician beneficence. The right to refuse treatment seems a relatively straightforward issue when the patient is a competent adult. But what if the patient is a child whose parents reject the recommended medical treatment on religious grounds? Consider the case of 11-year-old Ian Lundman of Minneapolis, Minnesota, who died on May 9, 1989 after slipping into a diabetic coma. His diabetes had remained medically untreated, his mother and stepfather foregoing insulin in favor of prayers from Christian Science practitioners. Christian scientists believe that disease is a spiritual disorder requiring spiritual healing, not medical treatment. Or consider this scenario, typical of such cases. A 6-year-old girl is seriously injured in a traffic accident, and the only way to save her life is to give her a blood transfusion, which her Jehovah's Witness parents reject because the procedure is explicitly forbidden by their faith. The physicians proceed with the transfusion and save the girl's life, and the parents sue the physicians and the hospital. In a lot of scenarios like that, where it involves the harm or potential fatality of a minor, the courts will often rule in favor of the doctors and say that the doctors had the right to move forward with treatment in spite of the parents' wishes. And in some cases, parents who have refused medical treatment on the grounds of religion and it has resulted in the death of their children are sometimes prosecuted. So religion is not the only reason that people will sometimes refuse treatment. Another example of a scenario in which a person refused treatment involved a quadriplegic woman who was unable to take care of herself. Her parents were unable to take care of her. She did not receive assistance, and she had decided that she wanted to be kept hygienic in a hospital as she allowed herself to starve to death. As a response, her doctors forcefully put in feeding tubes and put her into psychiatric care. She fought the doctors legally all the way up to the Supreme Court, at which time the Supreme Court decided that she had the right to say she didn't want to continue eating and that she didn't want to have the treatment of having the feeding tube placed. The defense by the doctors was that they could extend her life by 15 to 20 years. And at that time, the Supreme Court ruled that you cannot use longevity to justify overriding a person's autonomy, because this woman, even though she was a quadriplegic, she had full autonomy, as in she had the ability to make decisions for herself. And the decision she made for herself was that she did not want to be alive. That is its own bioethics conversation. Very interesting. Voluntary euthanasia. Maybe we'll try and cover that later on this year. Those are examples of how refusing treatment is patient autonomy conflicting with physician beneficence. The next situation where we see patient autonomy and physician beneficence collide is when futile treatment is provided. Essentially, this means that a patient wants a treatment and the physician believes that the treatment violates his beneficence, usually on moral grounds. So this would be the kind of scenario where perhaps a person is seeking a contraceptive of some kind, such as birth control, and a doctor's religious moral groundings would dictate that he would not prescribe this birth control to this woman. That is not a decision that physicians are allowed to make for patients. Now, can the physician say something along the lines of, you have X, Y, or Z going on metabolically, and birth control could really mess up this thing going on in your body? That's allowed. That's a doctor providing beneficence. It's not the same thing as saying, I personally don't think you should have this medicine. Medical futility involves the alleged pointlessness or ineffectiveness of administering particular treatments. So this says that physicians are not obligated to provide treatments that are outside of the reasonable standards of medical practice. What this means is that a doctor does not have to amputate a leg if you say, hey doc, I'm tired of my left leg, I just think it needs to go. A doctor has the right to be like, no thanks, I'm not going to do that. So that would be considered outside of the reasonable practice of medicine. So how can we apply the moral theories that we have learned to this concept of patient autonomy and paternalism? The three moral theories that we are really going to concentrate on for the remainder of the course are natural law, utilitarianism, and conscientism. Natural law would lean towards paternalism because it says that we inherently know inside what is right and wrong because that's how we were designed, is just to inherently know what's right or wrong. So according to natural law, the doctor has a better intuition of what that right or wrong decision may be. A Kantian moral theory would reject paternalism 100%, but also say that forcing a physician to perform is not morally permissible. What they would say is it's never okay for a doctor to do something without permission of the patient. If a patient comes in unconscious and they are potentially going to pass away, the doctor is obligated to let them pass away because he doesn't get their permission. He or she doesn't get their permission. And then the last moral theory is utilitarianism. Utilitarianism involves a really strong respect for self-determination. And so it says that nobody can interfere with someone's liberty except in the event to prevent harm. So it's hard to say what a utilitarian would do. Oh, no, it's not. So a utilitarian basically is going to say, in one scenario, it's appropriate for the doctor to act paternalistically, and in another scenario, it's not. Utilitarianism is kind of a halfway point between Kantian moral theory and natural law. And that is going to do it for this lecture. I will see you guys next week.